Hello everyone, welcome to Facebook Live. We are on the Aster Clinic's live Facebook page. I would like to thank you for joining us. I am Dr. Kiriti Mohan Marya. I am a specialist orthopedic surgeon with Aster Specialty Center for Orthopedics and Physiotherapy in Gises. The purpose of our talk today is to discuss about sport, exercise and yoga related orthopedic problems. And at the end of my talk you will be able to realize that there are certain issues with this and we should all be careful about that. Now exercise, if it was a medication or a pill, it is said that it would be the most prescribed medication in the world. Such is the importance of doing regular exercise that the benefits of that can be seen right from head to toe. For patients who have anxiety, those who have issues about hypertension, blood pressure, exercise importance is to reduce their blood pressure levels, to reduce their anxiety. If you are suffering from a thyroid ailment or ailment about insulin which involves the pancreas, exercises also reduce the burden of insulin or the requirement of the medication for the same treatment of diabetes. Exercises helps you to build up your muscles. If you meet any orthopedic surgeon or a rheumatologist worldwide for any kind of joint problems, exercising would be the number one thing that they would prescribe to you with or without medication. Exercises also allows you to increase your muscular strength. Not only that, it improves your bone strength. So people who regularly exercise, they have lesser chances of developing osteoporosis towards 60s or 65 years of age group. Exercises allows you to remain more focused on your job. So the benefits are immense, and the benefits are so much so that His Highness the Crown Prince of Dubai has announced the next 1 month being the Dubai Fitness Challenge. So there is no argument about the benefits of exercise. Yoga is another form of exercise. It is supposed to be a 10,000 years old exercise for not only the body but as well as for the mind. Originated from India, it has taken the world by storm now. There are a lot of people worldwide. There is hardly any country in the world which doesn't practice yoga anymore, and people have been deriving a lot of benefits from yoga, which is one of the most safest kind of exercises. In US in 2016, 36.7 million people are practicing yoga. So you can imagine the scope of number of people practicing either sport professionally or on their own at personal level, training, yoga, other form of exercises. It is very important to understand that there is no exercise without injury. The intensity of exercise or the type of exercise that you do may define what kind of injuries you get during that. So for example, if you are playing sport which includes a lot of contact like football, chances of injuries are much more. There are other safer type of exercises, for example swimming or walking, which doesn't involve any contact with other people. Chances of injuries are definitely minimal. Even yoga is not without injuries. In fact, it would be surprising that I have had, and many of my other colleagues have had patients who have not been having any major issues, minor issues with their joints, started doing yoga because they were advised, but maybe they didn't do it properly or they were not given proper instructions. And after having started yoga or some other kind of injury, some other kind of exercises, they have actually come back to us with worsening of their symptoms. I have had yoga instructors, professional yoga instructors who have had some kind of injuries, although minor, and we had to resolve them. So it is important to understand that whatever exercise you do, you should be doing it with the proper training. Now, millions of people are reporting injuries worldwide with exercises and sport. We are not taking away any benefits. I am one of the strongest proponents of regular exercise, but regularity is the key. Today we are not discussing about professional sport, but we are discussing about recreational sport that people do in their ordinary lives throughout the week or on the weekends, and people who practice different kind of yoga. Now we can classify the sport injuries by different mechanisms, but the easiest one to understand is injuries which happen in acute setting or some injuries which happen in a overuse setting. Acute injuries are simple. They are like accidents. You are playing some sport, you fall down, you injure yourself, acute injury. It may not be related to your sport as well. You are swimming, you come out of the pool, you slip, fall down and break a leg. Acute kind of injuries. People who play football, for example, or other kind of sport which involves a lot of running, they sometimes tear their tendons. A hamstring tear is a very common tear in football players. So these kind of injuries are in acute settings. There could be fractures, soft tissue injuries and stuff like that. But the ACL tear, for example, which is the most common injury which football players have, is acute injury. What we are concentrating today is more on overuse injuries. They are the milder form of injuries which don't give you a sudden pain and a sudden acute pain, but pain which appears to you after some time and keeps bothering you for a little longer period. Now these kind of injuries are called as overuse injuries or repetitive strain injuries, right? For example, tendinopathies, heel pains, Achilles tendinitis, or you must have heard about a tennis elbow, pain on the outer sides of the elbow, making it difficult for you sometimes to lift up things or to drive and stuff like that. So people who play racket sports, for example, tennis, badminton, they are more prone to develop injuries around their wrists and elbows. And on the other hand, people who are into running activities, they can even have fractures which are called as stress fractures in their feet, because it's all about how you are trained about that. So the first important thing to understand is that injuries generally happen because we are not ready or prepared for that sport. So it's very important to choose a sport according to your fitness level. Gradually build upon that. The more the chances, the lesser is your fitness level, the more are the chances of you to get hurt or injure yourself while doing those exercises or sport. I have had a lot of patients, and my colleagues also have patients, who suddenly think about deciding to participate in a Dubai marathon or somewhere else without having to practice this for a long time, and they go into that, come back to us about 2 or 3 weeks after this, having participated in the marathon, and they are coming to us with their stress fractures in their feet or even in their knees. So every year it's a recurrent phenomenon, and our advice to such people is that if you want to participate in any kind of sport, be prepared for it. Prepare hard for it much before the actual event. I have a word of caution even for common people who are very fond of playing cricket or football here in Dubai or in the UAE on the weekends. So a lot of such patients come to us, and they have had their injuries which were very minor in nature, and they could have been easily prevented. Prevention is the key. They could have been easily prevented if they were doing regular exercise throughout the week. And we call such people as weekend warriors, because they are going to the game with full spirit, but they are not prepared. Their muscles are not prepared for that. So it's important to choose your sport and prepare from a zero level and increase your intensity gradually, so that you build upon your stamina. Your muscles are prepared for that. Now, as I said, it is the prevention. It is the prevention of this injury which is most important. There are injuries which can cause you to have pains in your legs, which are commonly known as shin splints. They are basically micro injuries on the covering, which is called the periosteum of your leg bone. And if you suddenly start running and you are not used to it, after 3 or 4 weeks of this activity, you start receiving a pain or getting a severe local tenderness at the middle or the lower third of your leg shin bone. Prevents you from running more for next 2 to 3 weeks. So injuries take you back a certain level. So prevention is the key. Now, how do you prevent having injuries? That is what the major issue is all about. So the first important tip is to do a proper warm-up. Whether you are a child or an adult, whether you are a professional player or a casual player, warming up is the most important key, because it increases your body temperature, it increases your temperature of the muscles. If you see a lot of professional players, they wear thermal inners, and that is because they want to increase the temperature of their thigh muscles before they enter into the game. So warming up for about 10 to 15 minutes by doing a mild treadmill or a walk is important. Now once you have done the warmed up, it is important to do certain kind of stretches. Stretches allows your muscles and tendons to get prepared for the kind of activity that you might be going in for. So tendons which are cold, they are more prone to tear themselves microscopically. Tendons which are warmed up, muscles which are warmed up, they have less chances of injury while doing your play. So once you have done your stretches, it's important that you play your sport or whatever activity that you are doing, do it, but do it in a proper way. It's always the good guidance under a professional trainer which helps you. If you are suffering already from a neck pain or a joint pain, please discuss it with your orthopedic doctor before getting into that sport or activity. I have had patients who had cervical problems. They started doing some Shirsh asana, which is standing on the head, as a asana in yoga. They had tremendous disc issue within a day of doing that, and then landed up in surgery. I've had patients who had minor knee issues, who are doing fine in their lives, started doing some specific exercise like cycling. The problem becomes worse because the kneecap has a cartilage lining on the inside. So if you are going to do any activity which like involves doing a lot of squats or lunges or cycling or climbing stairs, and if your knee already has a cartilage issue, it will get worse. So talk to your doctor before you plan to go in for any kind of exercise and prevent having those issues. Now coming back to what you need to do. So once you have done your exercise, please make sure that you allow your muscles a cool down phase, which basically means that you do again some kind of minor stretches so that your body temperature starts to come down safely, and you suddenly don't change your temperature from a very heated body to a very cold environment. It's also important to know about hydration. People who play a lot of sports, especially here in the UAE, because you are playing outside, you may be sweating a lot, your body loses a lot of electrolytes, and muscle cramping is an issue about loss of electrolytes. So sport drinks are generally recommended to have after you have done your sport activity, and if you're sweating a lot. Nutrition is another important factor. If you are going in for any kind of sport, you should be eating a regular healthy diet. Now healthy diet doesn't mean that you start taking a lot of protein supplements. So there are people who go in for professional gymming, bodybuilding. There are different league of people because they are doing professional training. But ordinary people who start doing some gymming are sometimes told by their colleagues to take protein shakes or protein supplements or creatinine just to increase their muscle bulk. They have their own harmful effects. They increase your uric acid, they shoot it up, they cause you to have secondary gout issues, and then you land up with a very painful and swollen joint, and then you can't do any exercise for the next 2 to 3 weeks. So it's better to have a healthy nutritious diet, but don't depend on steroids, for example. Don't depend on things like protein shakes and high dose supplements. It's also important to use a proper equipment. Most of the injuries happen because you are not trained to use that equipment, or you are using an equipment in a wrong way. Patients who use a lot of shoulder exercises, if the dumbbells that they are carrying or if the weights they are carrying is not being held in a proper way, aligning their wrist and elbows and shoulders in a proper way, they can injure their wrist joints and their elbow joints and their shoulder joints as well. So equipment handling is important. And don't forget a proper shoe. There are a lot of fancy and expensive shoes available in the market. We from our point of view, from orthopedic point of view, we don't recommend any of them as such in a specific branded way, but we always recommend choose the type of shoe with the type of activity you are doing. So a running shoe is meant for running, and a basketball shoe is meant to protect your ankles when you are playing basketball. So whatever activity you are choosing to use proper shoes. At least there should be a sport shoe, and you should not be running with a casual footwear or a formal footwear. You should be running on the right track. People who start jogging because their doctors have advised them to reduce their blood pressure or cholesterol and by doing regular exercise, they've been advised to run, but they start running on the pavement or the hard metal roads. They come back to us with joint pains and injuries. You should be preferably using a rubber track, or at least go for a walk on a normal treadmill, but don't jog on hard surfaces, especially while you're not wearing a proper footwear. It's also important to choose a trainer. If you are doing a training under a professional trainer, always helpful to you. And I would advise you to be cautious about overtraining. Listen to your body. The best advice anybody in the world can give you is not me or your trainer or somebody from the internet. It's your body. If your body tells you it's paining, listen to it. In common terms, we say no pain, no gain, but this doesn't hold valid for exercise related injuries. A pain while you're doing an activity, a body is trying to tell you something is wrong with that. Just reduce your level of activity. Try doing it after a few weeks again, or talk to your doctor if you're not really improving even after 3 to 5 days of having that particular pain. So don't assume that you can reduce your pain by doing an overactivity. There's a difference between a muscle soreness versus a pain, and our body tells us that. Only thing is we sometimes ignore those changes. Please remember, all injuries are best prevented. Most of the research in the world right now in professional sport is going into injury prevention and not into injury treatment. Such is the importance of prevention. But when your body tells you something, please listen to it, and then share those concerns either with your trainer or your yoga instructor or your doctor. Before going in for any specific sport, always discuss with your instructor that I'm already suffering from these kind of issues, and they should be careful about that. And sometimes the instructors are a little bit more aggressive. There is no time frame for exercise. Exercise is all about your physical fitness, and fitness is about healthy body. You should not go in for fitness, injure yourself, and you are leading an unhealthy life, right? So this is the important thing. What do you do when you get injury? It's a very common thing. Everybody tells you that it is the RICE regime, RICE, which is you should give rest to the part whichever is injured, elevate it. Important thing is ice it. So if you put an ice pack on the painful part, the swelling chances are reduced. So the icing has to be repeated every hour, 2 to 3 hours for about 15 or 20 minutes, and keep it for 1 or 2 days. So rest, ice, compression. Compress the part with a crepe bandage or a simple bandage so that the swelling doesn't become too much, but make sure that you're not compressing it too hard. And elevate the part. So if you elevate, you lie down, raise up your leg, your swellings will be much lesser, pain will be much lesser. And if even after having done your RICE regime you feel things have not improved in the 48 hours period, go and see your emergency physician or your general physician or orthopedic surgeon according to your requirement or a preference. The last thing is about modification of techniques. Certain times simple modification. For example, if I am enthusiastic about doing yoga but I have a knee issue, I can tell my instructor, and I could be doing some exercises of the upper body without having to do certain asanas which can cause me to squat and kneel or sit cross-legged for a long time with my knee problems, and so that I don't get the problems becoming worse. So if you are doing it in a proper way, all exercises are beneficial. You only need the help of specialized orthopedic surgeons or physiotherapists or other people when you are into a trouble. A brief word about how to get rid of these injuries once they have already happened. The first thing is, apart from the RICE regime, a change in the way that you are handling things. So if you have a tennis elbow, avoid the racket sports for a few days, because if you are using your wrists too much, your muscles which attach to your lateral condyle or the bone, they are getting more strained. So if you avoid racket sports, if you avoid writing on the keypad too much, these things improve. If you are already having a shoulder issues, you should be avoiding driving with one hand, which a lot of people do that. So there are simple techniques. A patient who has developed a cervical issue situation and allow you to remain fit and healthy in the future as well. So to sum it up, I would like to thank you, and I would wish you all the health and good fitness levels in the future. Thank you for joining us.